Hello, we'll be now studying about the bone scapula. This one is the scapula. Under these headings, type, what type of bone it is? It is a flat type of the bone. Situation, where exactly this bone is situated? It is situated in the posterior chest wall extending between 2nd to 7th ribs. Side determination. For the side determination, to know the side determination, let me first tell the basic parts of this bone. This scapula contains two surfaces. What are they? The one in front, which is closely related to the ribs, hence this is called costal surface, and the one behind, this one is the dorsal surface. It consists of two surfaces. This is costal surface and this one is the dorsal surface. It consists of three borders. This one is the superior border, this one is the medial border, this one is the lateral border. Similarly, three angles. It consists of lateral angle here, superior angle here and inferior angle here, and three processes. It consists of this one acromion process, this one spinous process and this one coracoid process. Now for the side determination, the costal surface should be in front. That means this surface should face forwards. It cannot be like this or like this. Second thing is, this lateral angle which is formed by the glenoid cavity should face laterally and upwards. Glenoid cavity should face laterally and slightly upwards, and this one, which is the spinous process, should lie posteriorly. So with these 3 points, I can say that this belongs to right side. I repeat, the glenoid cavity is facing laterally and upwards, the costal surface is facing forwards, and this spinous process should be present posteriorly. With this, I can say that this belongs to right side. If I hold it on the wrong side, if I think that it is left, glenoid cavity is becoming medially. If by chance if I turn it like this, keeping the glenoid cavity laterally, the spine is coming forwards, which is wrong. Is it clear? Hence, this bone belongs to the right side. Now coming to the presenting parts and what are its features, let us start with two surfaces. What are the two surfaces? The one in front is costal surface, the one behind should be the dorsal surface. Is it clear? So this one is the costal surface, this one, and this one is the dorsal surface posteriorly. So this costal surface here, if you see, it is shallow, and this costal surface, majority of it, 2/3 of this costal surface here, it receives it gives the origin to a muscle called subscapularis. This costal surface, it gives origin to subscapularis, and along its medial end, close to its medial border, it receives the insertion here of serratus anterior muscle. Serratus anterior is inserted here in the form of 3 digitations. I repeat, majority of this surface gives origin to a muscle called subscapularis, and along its medial end, including the medial border, it receives the insertion of serratus anterior muscle. Now coming to the dorsal surface, this one is the dorsal surface, that is the surface present behind. It is present behind. This dorsal surface is divided by this spinous process into two fossa. The fossa above, it is called as supraspinous fossa because it is present just above the spinous process, and the fossa below we call it as infraspinous fossa. From the supraspinous fossa here, a muscle takes origin, that is supraspinatus muscle. Supraspinatus muscle takes origin from the supraspinous fossa, and similarly from the infraspinous fossa, the infraspinatus muscle takes origin. What is dividing this dorsal surface into two fossas? It is the spinous process. So the region between this spinous process and this glenoid cavity here, this one where I am putting my finger, that has to be a notch. Since it is present between spinous process and glenoid cavity, it is called as spinoglenoid notch. It is called spinoglenoid notch, transmitting suprascapular nerve and vessels. The spinoglenoid notch contents are suprascapular nerve and vessels. This suprascapular nerve supplies this muscle as well as this muscle. That means supraspinatus and infraspinatus both are supplied by suprascapular nerve. So this is about the two surfaces, costal surface and the dorsal surface. Now coming to the three borders, I said this is a superior border, this has to be the lateral border, and this one has to be the medial border. Superior border, if you see, this superior border, it is notched here, where I am putting my finger, it is notched. This notched one is called as suprascapular notch. I just draw that border here slightly. So roughly if you see, this is that notch. Somewhat like this, if you see, this one is suprascapular notch. It transmits suprascapular vessels. It transmits suprascapular nerve, and along its medial margin here, if you see, that means somewhere here, a muscle takes origin, and that muscle is inferior belly of omohyoid. Along the medial margin of this suprascapular notch, a muscle called inferior belly of omohyoid takes origin, which goes into the neck and divides the posterior triangle into upper occipital triangle and lower subclavian triangle. In the living, this notch is converted into foramen by a ligament like this. A ligament extends in the living, not on the bone, in the living. That ligament we call it as transverse scapular ligament. Transverse scapular ligament, thereby converting this notch into a foramen in the living. From the notch, the artery lies above the ligament, the suprascapular artery passes above the ligament, whereas nerve passes through the foramen. Is it clear? So that is about the superior border. Now coming to this border, that means this border from extending from here to here, this one is the medial border. This medial border receives the insertion of three muscles. Mind you, it receives the insertion where the muscles coming from the midline, that is coming from the spines, they come and get inserted like this from this superior angle to the spine, this region. This border till here receives the insertion of levator scapulae. That means from here to here, it is an insertion of levator scapulae extending from the superior angle to the spinous process. Then across the spinous process here, it receives the insertion of rhomboides minor. That means this is a spine, across it along the medial border like this here, it is rhomboides minor, and the rest of the border here like this one receives the insertion of rhomboides major. So along the medial border from above downwards, the muscle inserted are levator scapulae, rhomboides minor and rhomboides major. Now coming to this lateral border, this one is a lateral border which is somewhat thick. It extends from the lateral angle to the inferior angle. This is inferior angle, this one is a lateral angle formed by the glenoid cavity. This is a glenoid cavity. So this is a lateral border which is thick. In its upper part, it is the origin of teres minor. So teres minor is here like this. This is the origin of teres minor, which is comparatively smaller muscle origin, and the majority of it here, this bigger muscle in the lower part, this is the origin of teres major. So teres minor in its upper part, teres major taking a major contribution from its lower part. Always major is like a mother, minor is like a child. It is just like a mother holding a child in the lap. So minor should come from upper part and major should come from the lower part. This is the origin of teres minor and teres major. So these are the three borders now. Superior border is over. I repeat, inferior belly of omohyoid, suprascapular notch, transverse scapular ligament, etc. Medial border, levator scapulae, rhomboides minor, rhomboides major, lateral border, teres minor and teres major origin. Now coming to the next one, that is three angles. What are the three angles? This is superior angle, this is inferior angle, and this glenoid cavity forms the lateral angle. Superior angle, inferior angle, lateral angle. Superior angle forms the junction between superior border and medial border. Inferior angle, this one forms the junction between the medial border and lateral border, and lateral angle is represented by the glenoid cavity. So along the inferior border here, some fibers of close to the inferior angle, some fibers of latissimus dorsi takes origin. Along the inferior angle, some fibers of latissimus dorsi takes origin. Coming to this lateral angle, which is formed by the glenoid cavity. See, this one is a glenoid cavity, which is pear shaped hollow cavity like this. If you are seeing it from the side, it will be somewhat like this, having a tubercle above and below. That means a tubercle here and a here. These tubercles are called, this is supraglenoid tubercle and this is infraglenoid tubercle. Similarly here, supra and infra, here supraglenoid tubercle and infraglenoid tubercle. From the supraglenoid tubercle here, it is the biceps which takes origin. It is a biceps muscle, that is the long head of the biceps, under cover of the fibrous capsule, being intracapsular. So this long head of the biceps at the origin to till the intertubercular sulcus is under the cover of the fibrous capsule of the synovial of the shoulder joint, and hence is intracapsular. And this one receives the origin of long head of triceps. From the supraglenoid tubercle, it is long head of biceps. From the infraglenoid tubercle, it is long head of triceps, both origins. And this shallow glenoid cavity articulates with the head of the humerus to form a synovial ball and socket multiaxial shoulder joint or glenohumeral joint. Along the margins of this glenoid cavity, a fibrocartilaginous rim called glenoidal labrum is attached. Outside that, it is the fibrous capsule which is attached. This glenoid cavity actually represents the head of the scapula. If someone asks you what is head of the scapula, you can say it is a glenoid cavity, and the rest of it is called as the body, and the constricted portion underneath the glenoid cavity, it is considered as the neck of the scapula. Now coming to the last one, that is the three processes. It consists of three processes. This one is spinous process here. This is spinous process, which is containing an upper lip. This is upper lip. Similarly, this is lower lip. Is it clear? And this upper lip continues as medial border of acromion process, and the lower lip continues as the lateral border of the acromion process. This is acromion process. Is it clear? So, to the upper lip here, to the upper lip of the spine of the scapula, to the upper lip of the crest of the spine of the scapula, it is the insertion of trapezius, and from the lower lip here, it is the origin of posterior fibers of deltoid. I repeat, to the upper lip, it is the insertion of trapezius muscle. To the from the lower lip, it is the origin of posterior fibers of deltoid. Next, coming to this process, second process, which is the acromion process. This is the medial border, this one is the lateral border. From the lateral border, the middle fibers of deltoid muscle takes origin. From the lateral border of the acromion, the middle fibers of deltoid muscle takes origin, and from the medial border, it is nothing but the insertion of this trapezius. Here we find a facet, somewhere here a facet is present. That facet articulates with, this is that facet here, facet along the acromion process, which articulates with the lateral end of the clavicle like this to form a synovial plane type of acromioclavicular joint. Is it clear? So this facet is meant for articulation with the lateral end of the clavicle. Now coming to the last process, that is coracoid process. This is a hook-like process projecting in front and laterally. It forms an atavistic type of epiphysis, that means phylogenetically it is an independent bone, but for the sake of nutrition it comes and gets attached to the host bone, that is the scapula. This coracoid process consists of a tip. This is a tip of the coracoid process. To the tip of the coracoid process or from the tip of the coracoid process, two muscles takes origin. What are they? Medially it is coracobrachialis, laterally it is short head of biceps. From the tip of the coracoid process, two muscles takes origin. Medially coracobrachialis, laterally short head of biceps, and the long head of the biceps from the supraglenoid tubercle. And medial border of this coracoid process, in its anterior part, it receives the insertion of pectoralis minor. This coracoid process having the medial border also, which is receiving the insertion of the pectoralis minor in its anterior part, and the rest of it gives attachment to a ligament called coracoclavicular ligament in the form of two parts, that is conoid part and trapezoid part, that gains attachment from the medial margin. Similarly, this lateral border or posterolateral border, in front it is giving attachment to a ligament called coracohumeral ligament, and behind that it gives attachment to coracoacromial arch. That means a ligament extending from the coracoid process to acromion process, we call it as coracoacromial arch. Underneath that arch, subacromial bursa is present, which acts as a secondary socket in abduction of the humerus more than over 180 degrees. So this is about the three processes, and this is all about scapula and its attachments in brief. Thank you.